What is the normal duration of the first stage of labor for a nulliparous woman? Correct answer is option B, 6 to 10 hours. What is the primary function of oxytocin during labor? Correct answer is option B, to stimulate uterine contractions. A woman in labor is experiencing sharp localized pain in the lower abdomen. What type of pain is this? Correct answer is option A, visceral pain. Which of the following signs indicates that the second stage of labor has begun? Correct answer is option A, full dilation of the cervix. What is the term for the thinning and shortening of the cervix during labor? Correct answer is option B, effacement. Which of the following is the most appropriate position for a laboring woman to be in a promote fetal oxygenation? Correct answer is option B, lateral. What is the most common cause of early postpartum hemorrhage? Correct answer is option A, uterine atony. When should the nurse begin to assess fetal heart rate during labor? Correct answer is option C, at the start of active labor. Which of the following is a priority nursing intervention for a woman with a prolapsed umbilical cord? Correct answer is option B, positioning the woman in Trendelenburg position. What is the most common presentation during labor? Correct answer is option C, cephalic. A woman is in the active phase of labor and has been given an epidural. Which of the following side effects should the nurse monitor for? Correct answer is option B, decreased blood pressure. The nurse is preparing a patient with a cesarean delivery. Which of the following is the most important preoperative intervention? Correct answer is option B, administering antibiotics as ordered. What is the term for the pressure on the cervix from the fetal presenting part? Correct answer is option A, engagement. During the third stage of labor, which action should the nurse anticipate? Correct answer is option A, the delivery of the placenta. Which is the first intervention if a woman labor is progressing too slowly? Correct answer is option B, assessing for maternal or fetal distress. Which of the following is a risk factor for uterine rupture during labor? Correct answer is option C, previous cesarean delivery. What does the term crowning refer to during the second stage of labor? Correct answer is option B, the fetal head becomes visible at the vaginal opening. Which of the following interventions is most appropriate for a woman experiencing back labor? Correct answer is option B, applying counter pressure to the sacrum. The nurse should expect which of the following findings in a woman experiencing transition phase labor? Correct answer is option C, intense frequent contractions. What is the most important nursing intervention following the rupture of membranes? Correct answer is option B. Check the fetal heart rate. What is the normal rate for fetal heart rate during labor? Correct answer is option B. 110 to 160 beats per minute. Which of the following is a sign of labor? Correct answer is option B. Lightning. What is the primary goal of care in the first stage of labor? Correct answer is option B. To assess maternal and fetal well-being. What is the most common method of pain relief during labor? Correct answer is option A. Epidural anesthesia. What is the term for the baby head rotating to fit the shape of the birth canal? Correct answer is option C. Flexion. The nurse assesses a woman in labor and finds that the baby is presenting with the feet first. This is known as. Correct answer is option B. Breech presentation. What is the primary purpose of a vaginal exam during labor? Correct answer is option B. To assess the position and presentation of the baby. Which of the following is the most appropriate intervention for a patient with a non-reassuring fetal heart rate pattern? Correct answer is option A. Administering oxygen to the mother. What does the term station refer to in labor? Correct answer is option B. Which of the following is the most common complication in the third stage of labor? Correct answer is option B. Postpartum hemorrhage. What should the nurse do immediately after delivery of the baby? Correct answer is option B. Place the baby on the mother abdomen. When is it appropriate to administer an epidural during labor? Correct answer is option C. When the woman is in active labor and requesting pain relief. A woman in labor is experiencing a severe headache and blurred vision. What should the nurse suspect? Correct answer is option A. Preeclampsia. What is the term for the complete expulsion of the placenta after birth? Correct answer is option D. Placental delivery. Which of the following is a sign of placental abruption? Correct answer is option B. Vaginal bleeding with a tense hard uterus. What is the primary concern in the case of shoulder dystocia during delivery? Correct answer is option A. Fetal brain damage. Which of the following interventions should the nurse perform first if the umbilical cord is prolapsed? Correct answer is option C. Apply pressure on the presenting part. What is the term for the full dilation of the cervix? Correct answer is option D. 10 cm dilated. When should the nurse begin monitoring for uterine contractions in labor? Correct answer is option C. During the first stage of labor. What is the term for the decrease in uterine tone after delivery that can cause hemorrhage? Correct answer is option B, uterine atony. What is the best indicator for a successful vaginal delivery? Correct answer is option D, the engagement of the presenting part. What is the first sign of uterine rupture? Correct answer is option B, sudden onset of sharp abdominal pain. What is the purpose of Leopold maneuvers? Correct answer is option A, to determine the position of the fetus. When is a forceps delivery indicated? Correct answer is option B, in case of maternal exhaustion and fetal distress. What is the best position for the laboring woman to enhance fetal oxygenation and uterine blood flow? Correct answer is option C, left lateral. The nurse noticed that a patient in labor has a temperature of 100.4 Fahrenheit. What is the most appropriate action? Correct answer is option B, continue to monitor the temperature. Which of the following is the most common sign of labor? Correct answer is option C, bloody show. A nurse is caring for a woman in the active phase of labor. She is complaining of severe perineal pain. The nurse should. Correct answer is option A. What is a common cause of postterm pregnancy? Correct answer is option A, placental insufficiency. A nurse noticed the baby heart rate drops to below 110. The nurse should. Correct answer is option A, change the mother position.